My name is John McDade. I am a Regional Outreach Coordinator at the State of Oregon in the Community Partner Outreach Program. And today we're going to be talking about the tips that are going to be most successful for an OHP application. If you have questions, go ahead and type in your questions and we'll get to those at the end. And here we go. All right, so how to start an application. What should I do before I meet the applicant? So it's always best, I don't want to say it's always best, but it's nice to make sure that your applicant has all of the things that they potentially may need when they arrive at your appointment. That way, in the event that there are any requests for additional information, you will already have that information in front of you so that you can go ahead and have that ready to go ahead and submit it. Let me show you actually what I'm talking about when it comes to one of the things you might be able to do here. So this is the Oregon Health Plan application checklist. Your organization can go ahead and take this. We have it in GroupSite, and from GroupSite you can go ahead and print it out. But we've tried to create a checklist of the materials or things that you may need or your applicant may need when they're submitting an application. Now the truth is they're probably not going to need every single one of these things that has been listed on this checklist. But the more that they have, the greater the chance you'll reduce of having to send them home to get more information to submit later, and you'll be able to complete it in a single setting. So you can see that it's 2 pages long. It's in GroupSite in the file folder section. You can also see the link that we provided in the actual presentation itself, and you can use that to get the Oregon Health Plan application checklist. So I encourage all of you, no matter what the form is in terms of how you reach out to folks in advance of starting the application, that you do some sort of prep if you're not using the form to make sure that they're bringing those things so that they can go ahead and have a successful experience. So a good practice for any good application assister. Let's also talk about what are some other best practices when you're assisting somebody. If somebody comes in and they're not exactly sure if they currently have coverage or if their coverage has lapsed or they applied with another organization, is that if you have access to MMIS, and not all of you will have access to MMIS, but it is a system that the state uses for any providers who are billing OHP. So I would first recommend all of you looking in MMIS, if you have access, to see if they have active benefits. If they have active benefits, obviously you'll not need to do a full application. So if you don't have access to MMIS and you would like to have access, you can consider partnering with a provider organization that does have access. You can approach them and ask them if they would be willing to sort of take you on as under their umbrella and give you access. Now they don't have to do that, so keep that in mind, but it's worth asking that you would be, the risk would be taken under their organization in terms of giving you access. So, and there's a lot of information in MMIS, and so that's why it's a system that's protected and limited access really to providers. If you don't have access to MMIS, you should be looking in your One Applicant Portal dashboard. You should always, no matter what, search your One Account dashboard. If they come into you and they say they're not already have an account, they say they've never come to your organization before, it doesn't matter. I would always, as a best practice, look in your One Account dashboard to see if you or anybody else in your organization has assisted them at some point or another. I know multiple occasions where different community partner organizations start, have somebody who comes in to see them. They are asked by the community partner if they've been assisted by their organization, and they say, no, I've never come to your organization before, or they say, I've never applied for coverage before. It doesn't matter what they say. I've seen organizations then do a search for them in their dashboard, and lo and behold, they actually show up in the dashboard. So the applicant may not always be clear that they may already have an account or have been assisted by your organization. So always make sure that you're searching for them, because once you have them in your dashboard, it's much easier of a process to know what the needs are at that moment to be able to best assist them. So let's say that they're not in your dashboard. So if they're not in your dashboard, and they're coming to you for help, but they have been assisted by another organization previously, and they need help immediately, you can go ahead and make sure, one, that you have them sign a consent form, and have them sign the consent form, and then email that consent form to the ohp.outreach email address. Once you've done that, you can go ahead and call the community partner phone line. There's no need to call the regular number that's for the public. Use the community partner phone line and ask for that person to be associated to your account. They can do that while you are on the phone. All of the community partner phone line folks who answer those calls have the ability to go into the ohp.outreach email, find your consent form that's been signed, and while you're sitting on the phone with them, go ahead and switch over to make you the community partner of record, and then you can go ahead and assist them from there. If that's, let's say wait lines are really long and you have the ability to give access through your own computer, there is that you can go ahead and have them sign up and create their own One Applicant Portal account. And when they set up their One Applicant Portal account, they can go ahead and designate you as their community partner of record, at which point, of course, you'll be able to see them in your dashboard. It also helps for self-sufficiency over time, that folks can go ahead and make changes through their own applicant portal. If they move, have a different address, those sorts of things, or it's time for renewal, and they need to go in there, they can also do, if it's necessary, through their own applicant portal. Of course, I want to make sure that folks never to forget, every single time you are assisting somebody, you must have the consent form. Now, the consent form is mandatory, so please do the consent form. It depends in terms of what format you're using to submit an application as to whether the consent form is present in it or not. If you're doing the One Applicant Portal, you will need to have them do a signed consent form, paper consent form. It's not baked into the One Applicant Portal, so you have to have them sign a consent form. If you're doing the paper or PDF application, it's actually baked into the paper and PDF application, and you can find it in Appendix C. So now here's where it gets a little bit tricky. If you're sending in the paper or the PDF application, sorry, if you're doing the PDF application or a paper application, just mail in, fax in, or basically include the signed consent form with the paper or PDF application. You'll still need to keep a copy for your own records. And if you're doing the One Applicant Portal, make sure that you are keeping that copy of the signed consent form. You don't need to mail it in. If you're doing assisting somebody through the federal exchange, to the marketplace, you still need to do a consent form. So it doesn't matter what they're eligible for, you'll always have to do a consent form, but you'll also keep a copy of that for your records. So to summarize, consent form every single time. You must keep a copy of it on file. If you don't want to keep it as a paper form, you can turn it into an electronic format so you can scan it. And in either situation, you'll always need to make sure that you're keeping it in a secure location. So if you're keeping it paper, make sure that it's in a locked file cabinet. If you're turning it into an electronic document, make sure that you're keeping it password protected or encrypted. And no matter what the format is that you're saving it in, you've got to save it for 6 years. So that's an awfully long time to have to save those, but that's a federal government requirement. So make sure that you have a protocol in place for making sure those are secure for 6 years, and then after 6 years that you have a plan in terms of how you want to go ahead and destroy all of those. In fact, while we're talking about it, let's go ahead and take a quick look at the actual consent form. We're getting reports from our processing center that too many of our consent forms are being filled out incorrectly by community partners. So we'd like to reduce that. If any of you have attended our collaboratives lately, you know that you've been hearing us say that. In fact, let's go over it real quickly. So when we look at the Community Partner Assistance Consent Form, it says Community Partner Organization here. That is your organization. Your organization probably, or many of your organizations, will use an acronym for your organization. Please don't use the acronym, but actually spell it out in its entirety. The reason for this is that there are many organizations across the state and our processing center simply cannot memorize every single acronym that exists for organizations out there. So please spell it out. So also, application assister name, please put you are the application assister, so please put in your name there. Your assister ID should also go there. And then when it comes to address, the address is that of your organization. So don't put in your personal address, put the address of your organization in there, city, state, zip code, and then we're talking about the applicant's name there on line 8. So make sure you put the primary applicant's name there, their date of birth, the applicant's phone number, and the name of other adults on their application. And of course, the total number of household members and the number of household members over 18. If you complete that, you're well on your way. But of course, you're not finished because you want to make sure at the bottom there's a signature. We're not looking for the signature of you as the application assister. We're looking for the signature of the applicant, because it is the applicant who is giving consent to you to assist them. And basically, the consent form says a couple things. One, that they are giving consent to you to be able to assist them, and that the information that's going to be used is going to be protected, but will be shared with OHP so that they can appropriately make an eligibility determination, or with the federal marketplace if your applicant is eligible for a private market plan. They're also limited in terms of what they can share. For instance, at the bottom, they can't share like information that's health information, like mental health status, HIV/AIDS, drug and alcohol treatment, or generic testing. None of sort of your medical information can't be shared, so there's protections there as well. I think it's always good to take the time to read this, or have your applicant take the time to read the consent form so that they know what they are consenting to. All right, let's go back to our presentation. And as it's related to the consent form, make sure you always do it, save it for 6 years, and make sure that you keep it in a secure location. All right, so starting an application, what do I say? So here's some of the things, like for this entire webinar today. If there's one thing you come away with and you forget everything else, today what I care about is probably the next 2 slides. This is the stuff that none of you probably have received in your training when you first come on as an application assister. We put a lot of information into your brain when you first become an assister. It's hard to maintain all of it. And then there's some things we just simply don't train to. But what I want you to start thinking about are scripts that you can create for yourself so that you become more efficient in sharing information and what to expect when starting an application. So when I start an application, the things that are important to me are respect, integrity, and time. One, I want them to know that they are respected, despite some questions may feel like, why are they asking me that? Integrity is that I want to maintain integrity, meaning that every person I work with, I treat equally, and that the integrity of the application maintains the same, and that time is valuable. So sometimes applications can take a long time, and I want to mention something about time and how much time we have. So I have this suggested script that sort of lays the groundwork for what's to come. And let's face it, some of the questions, in my opinion, might seem a little odd or even off-putting to some folks. So what should I do? So again, I'll recommend that you create the script. Let's face it, I think probably many of you have done some of these, and you'll ask a specific question about their health and their health history, and suddenly they will launch into a very long story about their health history. And the truth is, you just don't have time to capture all the health history, and it's not important when it comes to determining their eligibility. Or perhaps when you've asked someone their gender and they look at you like you're an idiot, here's a suggested script I would encourage you to use, or to create one that really matches your own personality or the things that might be unique to your own organization. So I'm going to read this for you so you have an idea of what you might say. So if you were my client, I would start off by saying, so thanks for signing the consent form. Before I launch into the questions on your application, let me tell you a little bit about how I usually do this. So I'm required to ask everyone who applies all of the questions, and I must read them for you. Look, I didn't create these questions, but I have to ask them. It's my intention to be equitable to everyone, So I will not assume any answers on this application, and I will leave the answer to you. Look, I think some of these questions seem a little odd, and I want you to know that it is not my intention to sound insulting, but rather to ensure the integrity of the process and ask everybody the same question. Remember, these are your answers, and you should answer them with what best suits you. So there are a number of questions that will be asked that have no effect on your eligibility. They are asked for to better understand the population who applies and how to best improve services for them. So, for example, questions about race and ethnicity do not impact your eligibility, but are used to better coordinate care. So I hope that helps them understand when we ask you those questions. And I also want to point out that the application is longer than I would prefer it to be, but I think we can get through it pretty quickly. And because there are a number of questions and we don't have a lot of time, I will ask that you stick to the choices provided. At this point, I won't need a detailed health history. That is something you can talk with your care provider about once we're able to get you coverage. Thanks. Shall we begin, or do you have any questions? So that's how I like to sort of cover those things that I described earlier that I see as important, and manage expectations of what the process will be like, and any questions that they might look at me sort of cross-eyed, like, why are you asking me that question? So I'd encourage everybody to create their own script and keep some of those things in mind as you move forward. So I was thinking about this last week around creating scripts, and fraud came up. So this is something I quickly put together if you suspect that there may be fraud. So this might be my script. So it's important that you answer the questions honestly. If you are dishonest on your application and it is later determined that you received benefits for which you were not eligible, you may be liable to pay that money back to the state. The state of Oregon every year recovers millions of dollars from those who have committed fraud, and it's just not worth it. So if you're not eligible for OHP, don't worry, you may be eligible for a private market plan where you can also get financial assistance in the form of tax credits and cost sharing. That will make that coverage more affordable. So it's best to answer all of the questions as honestly as possible so that we can see what you are truly eligible for and avoid any potential fraud. So let's go ahead and get started with these questions. So that's typically how I would handle fraud up front. And most of you have had folks every now and then who might suspect don't want to provide information and that sort of stuff. And this can help you create a frame for working with those folks. All right, let's talk about the paper application, Form 7210. So we've talked about the consent form. We've talked about starting the application and things that you might say to them, how to manage the fraud piece. But let's say you're not going to be using the one system, which I hope all of you are using the one system, but every now and then you can. So a paper application or the Form 7210, you can get as many as you want in the preferred languages that we print them in, and you can do so by emailing the OC email room at the email address you see on your screen. But you'll want to make sure that you include the following information. What is your desired quantity and in which languages? So if you want 50 in English and 75 in Spanish, please say that specifically in your email request. You'll see that we have the paper application available in English, Spanish, Russian, Vietnamese, Somali, Arabic, and simplified or traditional Chinese. You'll also want to make sure that you put your contact name on it, because when it comes to your mailing address, it will have your name on it, so it maximizes that it'll actually get to you. A reminder is keep a copy of the completed paper applications for 6 years. So anytime you have like your proofs, consent forms, those sorts of things, you need to maintain them for 6 years. That's a federal government requirement. So paper applications should be faxed with supporting requests for information along with a cover sheet. So, and I say faxing is not the only way. If you want to mail them in, that's fine too. But I think most folks, if they're doing the paper application or PDF application, are actually faxing it in. An additional resource that you have at your fingertips is GroupSite. And for everybody on the webinar today who doesn't use GroupSite, I would so strongly encourage you to go to GroupSite at a bare minimum once a week. There are lots of resources there and information that can be really valuable for you. So at least try to go there once a week. If you've forgotten your username and password, or you don't have an account, mostly if you don't have an account, please contact your ROC and they can help you do that. So if you've forgotten your password, when you log in at the web address you see there on the screen, it has a process to change your password and find out what your password is. So please, everyone, make sure that you are using GroupSite. It's a great tool. All right, at this point, we are going to take questions. And so if you have any questions, please go ahead and type them right now into the questions section. And it looks like I don't have any questions at this point, but go ahead and I'll wait for another minute or two and see if anybody has questions. All right, I'm not seeing any questions. So I'm going to let it go at that. What a delight to have all of you participating today. Remember, every other Monday, we have these mini webinars. Register through GroupSite through the link. Once you've registered once, you are registered for the entire series. So you're able to do that. And we'll give you the option to go ahead and put it in your calendars. If you don't attend one, that's certainly fine. We always have on GroupSite these recorded, so that you can go back anytime, re-listen to them, or catch up on any of them that you have missed. So thanks for participating, and have a great day. Bye-bye.